Greetings. I'm Tanya Abreu, a 30-plus year veteran in hospital planning, consulting, administering, and Imagineering. I started my career at McGee Women's Hospital and the University of Pittsburgh Medical Center under the extraordinary direction of Irma Gertzen and Jeffrey Romoff, and some of the best healthcare leaders I have ever had the privilege of knowing. I went from one golden education to the next with Dr. Stephen Klasko and a project that embraced my life for about 15 years called Spirit of Women. Dr. Klasko started believing at his hospital, Lehigh Valley, that women would respond more to a world at a hospital that was not just about procedures and medical knowledge, but also about their spirit, how they were feeling, what they wanted from a doctor in a hospital. And our marketing company was born. At its heyday, had more than 200 hospital clients that leveraged and licensed our ideas for growth and stability. Currently, I am proud to be a senior advisor for healthywomen.org, the largest online and oldest online resource in women's health. I also am proud to serve hospitals and healthcare providers as a brief interim consultant to listen to ideas and to share my own experiences and to plan for a very, very structured and focused success. Today, I want to talk to you about America's beginning its recovery from COVID-19. While most of the cities and states and boroughs begin to open its business doors in its recovery mode from the pandemic, most hospitals face challenges like I have never seen or heard about. Cash-strapped hospitals are panicking like the proverbial fish out of water. 43,000 jobs alone were cut from hospitals in March, not to mention layoffs and furloughs. And I don't want to pick on HCA, but HCA posted record losses, I think 44% in its last quarter. The fact is, and Becker's Hospital Review is my Bible these days on stats. The fact is that 1 in 4 hospitals are weak enough in the next year or two to have to face closing. It's higher, of course, for smaller independent hospitals and rural access hospitals. But the closures are not always about the lack of cash on hand. It's not always revenue shortages that threaten our hospitals. It really is about the panic and the lack of infrastructure and the fact that COVID caught the U.S. hospital system like the Wizard of Oz, if you give me this metaphor. Everything was so superficially beautiful and promising and full of potential that anybody would believe that it was the most magnificent place in the universe. Just like I think everyone in the world believed that the U.S. healthcare system was the most magical and undaunting infrastructure in magnitude in the world. But very rapidly, we saw that we had no plan behind the scenes for a crisis. We had no plan for this pandemic. As I said, I've been in hospital planning for 30-some years. And I have seen, especially in recent years, that hospital hands and feet have been tied. Literally tied. Increasing operational costs, increasing staff costs, and then shortages of important staff, especially those staff that could be billed for, rapidly decreasing reimbursements, while there's been rapidly increasing regulations and restrictions on who hospitals can work with and what kind of providers and what kind of partnerships, so that they couldn't even make ventures happen for additional resources. And the truth is that hospitals didn't have enough cash on hand to have reserves of critical supplies for an infectious control disaster of what we're facing. I don't want to be the negative Nelly. That's not who I'm known to be. All is not lost. And all I can say over and over again is to ask hospitals to return to the vision of what hospitals were created to be, and to imagine hospitals and healthcare systems again to be the epicenters of public health. Now, not all hospitals are going to survive in a market. You can't have multiple epicenters. So I really do believe that there will be specialty care centers, but there will be an emerging, depending on the size of the city, 1 or 2 hospital systems that come out as the epicenters of public health. Population health now has to be on steroids. It can't be a couple of programs here, a couple of programs there, a report that gets generated a couple of times a year. It really has to be a structured approach to plan to function as a hospital that is a public health resource. And the hospitals that plan for that right now and have a detailed roadmap to get there will be the hospitals that grow and thrive. It's no longer a world of return on investment. It is instead a return on imagination. I've been following Dr. Klasko at Jefferson Health now so closely since this pandemic began. And every presentation and every communication he writes or speaks has at its center optimism, innovation, and imagination. Those are the things that have kept every industry in the United States great, even through the Great Depression. It's about flexibility, creation, resilience, and going beyond that sense of, I can't, we can't, we don't have the money, we've never done it this way, to, all right, let's just start over and look at our strongest points, our strongest resources, our strongest staff, and let's create something that is going to be remarkable. The value right now is in the power of thinking ahead, not just thinking, but thinking ahead. And we now know that Americans think of health very differently than they did in January of 2020. This is my opinion, but I've been reading and researching. Most Americans now believe more than anything else that knowledge is the best medicine, that knowledge will protect you, and that you're not always going to get knowledge from the sources that you used to trust. And who do you trust? Americans don't know who to trust. I believe every hospital, as I've always believed, has to talk to women. We still increasingly make more than 90% of the household decisions, and we make up more than 85% of the healthcare workforce in the United States. So how do we convince women that as hospitals and healthcare providers, we are giving them good, useful, real knowledge? So I think knowledge is the best medicine. I think there's not an American, well, maybe there are some, but most Americans believe now, really in a way that they might not have, that prevention is the best cure. We see that some people get sick and some people don't. And it doesn't matter what age and how do we protect our bodies? How do we increase our health? How do we improve our immune systems so that if we catch a COVID virus, a coronavirus, we can fight it successfully? I think the third thing that Americans now believe healthcare is that if you have a trustworthy personal relationship with a provider, you can protect your family better. So if you have a good relationship with your primary care doctor, if you trust your hospital and the information they're putting out there, then you know that you can do a better job with your family and with yourself. How is your hospital planning to heal? And what's the plan? How is it planning to thrive? Right alongside with the American consumer who is sick right now. Whether they have caught a virus or not, they really believe that they are vulnerable. And how can you as a hospital prove that you're trying to be a epicenter for their health and the health of their family? A local resource, if you will, to empower them to protect themselves. Most hospitals were caught with their content pants down, meaning their websites were all about their services, their doctors, their locations, but really not set up to one-to-one conversations with panicked families about how to get tested, what the symptoms were, where to go. And there wasn't very many hospitals, and believe me, I looked on all the major websites that weren't major academic medical centers. I think Johns Hopkins did an awesome job and is continuing to do an awesome job, that really I could go to every single day and say, whew, that's what I'm supposed to do. That's really what the masks do. That is why I wash my hands. All I saw was how to wash your hands, when to come into the ER. No relationship. And that is the future of hospital success. What are your relationships? Not just with the consumers, but with providers, outsourced service lines, all about how are you going to put your hospital in the middle of that hub and spoke model and spoke it out for success. Of course, I have ideas and resources that I want to share with hospital leadership. But, first, I think I really would love to hear what you're doing as a hospital in this interim period to look beyond shortages, to look beyond the regulations, to really think about what you need to do to regain the trust of the consumer, the trust of your employees, and probably most importantly, the preeminence reputation in your community as being an epicenter for public health. I'm going to give you my direct phone number. If you've listened this far, that's 561-358-5230, 561-358-5230. You can also email me or message me to set up a quick 30-minute discussion. I really would love to be a sounding board, someone that you can tell, hey, you're crazy, your ideas are crazy. I will never invest in marketing while I don't have enough PE equipment. I will never talk about relationship development when I don't have enough doctors to make me money. I want to hear you too. I think now's the time that we really work together to share ideas and lift each other's sense of the can-do. I finished a book, and now the author's name eludes me, but it's about never dwelling on what is, just create the what if. So let's have a what if conversation. Thank you for listening for 13 minutes if you listened this long, and I wish you the best and most rapid recovery personally and as a hospital from COVID-19. Thank you.